So what is VSED? It is an effective and safe way to hasten one's death by fasting from food and fluids. A person can live a long time and stop eating, but they don't live long if they restrain from any fluids. And sometimes a person will take a sip of water or maybe a bit of wine or ice chips, and that's okay. It just lengthens the process it takes to die if you do continue some fluids throughout the process. VSED is an action by a competent person with full mental capacity who voluntarily and deliberately chooses to stop eating and drinking with the primary intention to hasten their death. It is a very well thought out decision and carefully planned that one considers before embarking in the process. And unlike the Death with Dignity Act, such as End of Life Choices Oregon, VSED does not require a doctor's authorization or a terminal diagnosis. What VSED is not. VSED is not starving to death. It is death by dehydration. It is not commonly a painful experience. The discomfort from VSED is effectively mitigated through good palliative care measures. In a 2003 study in palliative medicine, hospice nurses in Oregon who had cared for VSED patients rated their deaths on a scale from 0 to 9, 9 being a very good death. The nurses assigned a median score of 8. Nearly all of the patients died within 15 days. There are significant differences between VSED and how most acts of suicide are carried out. Using VSED to hasten death is an altogether different act of dying. Technically, and in the literature on the nature of VSED, it falls into the category of suicide. As the word is used in various contexts, it is very important to distinguish the act of using VSED being an altogether different form of suicide and one that is not morally wrong. Individuals who thoughtfully pursue elective death should be granted the respective terminology that distinguishes their choice from the sudden, often horrifying, ill-considered negative choice of suicide. The pervasive dialogue referring to VSED as suicide is misleading and contributes to misinformation about this process and has an impact on its ethical evaluation. VSED and MAID, medical aid in dying, both involve a deeply considered decision based on self-love, peace, and compassion, both for oneself and for family and friends. There are three central domains of a person's life that are affected when their life is interrupted by declining health. Think of the epicenter of an earthquake, the place in the earth where rupture happens and things from there begin to radiate outward, affecting and destroying structures. The structures closest to the epicenter are most affected. I think of this as a good analogy to what happens to the foundation of a person's being. In the center, in this rendering, I have placed the physical aspect of a person's life. When this part ruptures, the effect of one's physical condition radiates outward, affecting the other domains of a person's being. Their psychological, their spiritual and existential. And as their state of health deteriorates and their quality of life worsens, a patient begins to experience the psychological and spiritual distress as well. Quality of life is significantly diminished because of physical deterioration, when one can no longer do the things that brought them joy in life. A person whose life enjoyment and purpose came from so many of the activities they were able to do may now find themselves at a debilitating loss. A combination of factors in their physical condition contribute to their suffering. Debility in the use of their body and or mind, weakness and pain, and dependence on others for their daily need requirements. And usually a combination of these are all factors that diminish a person's reason for continuing to live. Cognitive decline is becoming a more common reason that people look at using VSED to end their life before they begin to lose their selfhood and their identity. A patient sometimes becomes very weary with living in life. They know they are in a state of decline, and depending on their condition and their age and their symptoms, the anxiety of living is just taking a toll on their happiness. They may suffer without any hope for improvement. They feel they have no more purpose in life. They can feel a loss of dignity that arises from not being able to care for themselves anymore. And depression is always a factor and needs to be assessed to see if that is a condition that can potentially be alleviated. However, usually depression is not the underlying factor for the pursuit in using VSED. The desire to have control over how one would like to end their life is a very common reason that patients consider in hastening their death. An individual just wants to know that there are still options and choices available to him or her to control the way that they have lived their life and the way that they choose to end their life. And a patient's awareness of their ability to control this important aspect of life can in itself be therapeutic. When someone is ready to inquire and use VSED to end their life, one cannot ignore the spiritual and existential concerns. And some of those are, what is the meaning and the source of their suffering? And the meaning of their life, it could be very, very much compromised, and they may feel that they have lost the meaning to live anymore. They can feel hopelessness about the future. Loss of self. This is particularly relevant to, persons who are beginning to experience the advanced stages of dementia and other cognitive conditions. As well as those physical debilitation, just losing one's sense of and the ability to be able to do so many things that you love to do, whether it would be walking the dogs or bird watching or going on long walks. And as someone's life becomes smaller and smaller and smaller and their quality of life diminishes, that contributes to this loss of meaning, to loneliness, and to feeling this sense of being complete with life. This chart illustrates a study conducted by National Center for Biotechnology. It shows the results of patients who indicated their primary motive to seek the use of VSED to hasten death. So you can see that physical, somatic pain came in first, but existential, is right up there as being one of the very top reasons, and then followed by being dependent on others, and then social isolation and not being able to do things that they socially once enjoyed, and then psychological being the lowest indicator of why they are choosing VSED, which would include things like anxiety or depression. So it is a standard practice for clinicians to order a psychological evaluation for a patient who wishes to pursue VSED, and then to have a discussion within an ethics committee to discuss the patient's request. And once in a while, but not usually, depression can impact and or impair decisional capacity. And an evaluation by a medical team gives them a chance to look at the patient's request from a more holistic perspective, taking into consideration a patient's history, their story, their stability and competency, and also hopefully they are also taking into consideration a respect and understanding and perspective of that patient's wishes. Several conversations will occur over time in order to further understand the patient's perspective. Each time that you have a conversation with a patient, you can get a better picture of who this person is, what their story is, how long they've been thinking about dying, what is their understanding of death, why they want to die, etc., etc. What are some of the psychological issues that arise with friends and family? It is normal for someone to be anxious about their family or friend who has chosen to hasten their death. There is a word in psychology called thanatophobia, which means fear and anxiety of losing someone you love. Not that someone is necessarily experiencing this, but it is something to be aware of. Feelings of guilt and anger towards the person wanting to die. One believes that they could or should have done more. Maybe they feel abandoned by this person choosing to exit their life ahead of time. Sometimes anger is necessary before one can move into acceptance. Family members feeling accountable with regard to insufficient support on their part. It is not uncommon for relatives or friends to step in and try to understand if there is something more they could have done in the past or can do now to help this person keep living a better life. Could they have done more to support this person? Thinking of an agonizing death by thirst or hunger, this myth can be clarified by explaining the facts about the VSED process. Ambiguity in their support If there are several family members involved, different members of the family will likely have very different responses. You can try to assist family members to move towards acceptance of the ambiguity and lack of control they may feel. Well, aside from all the conversations that will begin taking place, um, weeks before starting the fast, patients need to prepare. And aside from the conversations with friends and family and one's physician or healthcare team members, chaplain, religious community members, it's also a good idea that some of the hospices in the area are checked out just to see that they would be open to coming in to support the patient once they have started the fast. Clearly stating one's wishes in writing, and preferably also a recording of what they intend to do, stop eating and drinking, and what they want the caregivers to do should they ask for food and water while they are in the middle of their fast. Getting the post and their advance directives all completed, and they may want to begin giving away certain items that they have to certain people, different gifts and whatnot. And then if they live in a care facility of any kind, they just have to check in with administration, because some facilities don't allow a resident to use VSED. In choosing to use VSED, there are some obstacles to overcome. An important one is faltering in one's determination to carry through with the process. It can be challenging, but it can also work very well if one has the appropriate support needed. And there's less access to timely palliative care because of delayed hospice entry. This is due to someone not having the 6-month diagnosis. A client's personal physician may not be supportive of the patient's request to support the process, and this therefore results in they're not writing a hospice prescription, but this can also be overcome. And then getting the support care necessary, at some point in the process, pretty early on, 24-hour care is necessary, and it's usually going to be a private hire, and this can be costly, and just finding a caregiver for that can be challenging. And then various facilities do not support VSED, so it's the location on where one chooses to use VSED is really important, and one's home is the best place because many facilities will not support one's use of VSED. The need for caregiving support. A patient simply cannot do this without constant oversight and care. Caregiver's role is a keystone of the overall success of a patient having a successful and peaceful VSED experience. The caregiver must understand the VSED process. If they do not have experience with it, and most will not, they will need training and more oversight to make sure they feel confident and comfortable in their role. The caregiver remains in timely contact with persons he or she has permission to speak with, family members, friends, durable power of attorney for health care, the hospice team members, of course. So here I've given a VSED phase timeline, and I've broken it up into 3 general periods of time, from the beginning to the middle to the end. It is difficult to predict exactly when the end will come, and this depends on the person's physical condition or their age, their medications that they've been taking, their illness, their height and weight, and fluid retention and ability to remain completely free of all fluids during the process, as well as a readiness and a willingness to let go. Some persons die, within 4 days. Some take 2 weeks. Others take longer. The median time to death is about 7 days. In the first couple of days, the patient will very likely be quite alert. They may have some minor hunger cravings, but those dissipate after 2 to 3 days. But the thirst craving sets in pretty rapidly, and their energy levels will also begin to decrease, and the person becomes less mentally alert and a little bit more sluggish. The cessation of all the fluids, though, can make their mouth very dry and uncomfortable, and it's important that the patient have very good oral care from the start to keep the mouth, the lining inside the mouth, the tongue and the lips moistened. Anxiety levels are, if they become a concern, the palliative care team can always provide some anti-anxiety medication to help reduce the stress. And if any delirium begins to even set in this early stage, that can also be mitigated with palliative medicine. The middle of the process, which again is variable and unique based on so many different factors for each person, but for the sake of this slideshow, I've given the middle a time period between day 4 and day 8. So the person is becoming considerably weaker and sleeping for longer periods of time. They now need help to sit up and transfer. They may not have the strength to stand and move around much anymore. Their thirst, still continues, or the sensation of thirst continues, and again, just providing the good oral care throughout this process is necessary. The delirium, they may begin to have increased delirium, and it can be more pronounced in this stage. And this is when a patient may forget their decision of not eating and drinking, and it's the caregiver's role to remind them and to follow the instructions the person left about what to do during the VSED process if and when they forget. So following the patient's instructions will probably mean, gently reminding them what they are doing, showing them their written statement, and if they made a recording, to play the recording on what that person wishes, to gently refuse giving them any food or water if they ask for it, and then asking them or confirming, is this what do you want to do? Do you want to continue the VSED process as you wish? And they either say yes, or they can say I don't know, and then you can talk a little bit more, but maybe they say no, I've changed my mind. And at that point, it is the caregiver's responsibility to give them what they want. The duration of this late stage lasts around 1 to 4 days. At this point, the patient is largely unresponsive. They have gone into a deep sleep. And if they do happen to wake up during this time and experience any delirium or pain, that can be mitigated through palliative care. The patient needs turning and good skin care at this point to prevent bed sores, and hopefully they have a pressure mattress that was supplied through hospice. Very rarely does someone need palliative sedation or pain management really at this stage, but if they do, again, hospice and the palliative care team will address that. Well, this is a duration chart that was created as a result of a study to gain more insight for family physicians when confronted with patients who wish to hasten death by VSED. So the study aimed to describe physicians' involvement in VSED, to describe characteristics and motives of their patients, and to describe the process of VSED in terms of duration. So what I copied here was the process in terms of duration, just to give you some data on the time period that we've just talked about in the last few slides. So the data in this chart represented 86 patients, and the median time to death was 7 days. Again, a patient can change their mind at any time during the VSED process, so long as they have not begun to go into organ failure. Well, ethical and moral considerations can create considerable obstacles in a patient finding the support they need to pursue VSED. I wanted to understand some of the pushback that comes from within the medical community. There's not a lot of support really for voluntarily stop eating and drinking. And so in reaching across the aisle, so to speak, I felt it was important for me to understand that. And so I did some research into the 4 pillars of medical ethics, which are really the guidelines on clinical practice. And these pillars include patient autonomy, beneficence, non-maleficence, and justice. VSED raises challenging clinical and ethical questions when taken in the perspective of analyzing or weighing the ethical and moral issues. Patient autonomy, the right to refuse treatment, and this would include refusing to eat or drink. The ethical principle of autonomy is supported by United States statutes, regulations, and case law. Competent adults can refuse care even if the care would likely save or prolong the patient's life. However, even though this has the legal statute support, it is not without challenges to get support to carry the VSED process through. Beneficence, acting to benefit patients by sustaining life and treating illness. It strives for the best care while embracing not doing anything harmful. So the primary professional responsibility in end-of-life care is to relieve patient pain and suffering. A physician will do what they can to relieve the suffering, cure when possible, control chronic illness, palliate symptoms, improve mortality and function, and sustain life when possible. Non-maleficence, refrain from harm. If it is the active avoidance of any act that would cause harm. Some will say that there is a greater obligation to not cause harm than there is to do something that might benefit the patient. Although some interventions that patients receive might cause pain or harm, non-maleficence refers to the moral justification behind why the harm is caused. So regardless of the patient's wishes, the greater obligation is to not cause harm. Justice governs social fairness. Medical practitioners must consider whether other people or society could be harmed by a decision made, even if it is made for the benefit of the patient. A case, the bioethical dilemma. Even though this case is not one of the 4 pillars of medical ethics, I wanted to include it here because within facilities especially and in hospitals, and if a patient were to request VSED, after many assessments and interventions by health professionals to find out more information, to really, parts of what I've already talked about, hearing the story and assessing for depression, whatnot. A VSED request will be put before an ethics committee for discussion.